Okay, so let's talk about Ehler-Danlos syndrome. So Ehler-Danlos syndrome are many types. You can see many types of Ehler-Danlos syndrome, but focus on this type, classical Ehler-Danlos. Focus on first classical Ehler. This classical Ehler-Danlos syndrome is also the type 1 Ehler-Danlos. Now there are other type also, but we will be focusing only, we will be talking only about next other two, because if we talk about all, so you will be confused. So I don't want you, I want you to confuse. So just remember type 5 collagen and type 3 collagen defect. So you know that I already told you type 3 collagen is present in blood vessels, uterus, and fetus tissues. So that is why when there is defect in type 3 collagen, what will happen is vascular. So vessel will rupture, and that is your vascular Ehlers-Danlos syndrome. You can easily remember. Type 3 is because of vascular Ehlers-Danlos syndrome. Now, Kyphoscoliotic Ehlers-Danlos syndrome is because of lysyl hydroxylase. Now you can see this enzyme deficiency. Wherever you see enzyme deficiency, generally all enzyme deficiency are autosomal recessive. So this is autosomal recessive. These both are autosomal dominant. This is autosomal recessive. So Kyphoscoliotic EDS is autosomal recessive. How do you memorize this? Classical is has the type 5 collagen deficiency. So how do you remember? You can see what is the position of this letter number E in alphabet. Which number alphabet is E? 5. Number 5. So that is how you can remember. So classical is because of ADS, because of type 5 collagen. And this vascular itself suggests vascular. So in vessel, which type of collagen is present? Type 3 collagen is present in vessel. And this kyphoscoliotic is a very peculiar type of it. You will not have a very big problem because it is lysyl hydroxylase deficiency. It is autosomal recessive. So this we will talk about these 3 types only. So you can go through this, but I don't want you to memorize this already. And you can see the type of collagen that are involved in this EDS. There can be the type 1 involvement, the type 1 collagen. There can be involvement in type 5 collagen. There can be involvement in type 3. So you can see the odd number. You can see odd number. So you can remember odd number is number collagen is related to Ehlers-Danlos syndrome. So not even number collagen. So that is how you can get a trick to remember about this Ehlers-Danlos syndrome. So you can see other types as well. So I'm not going to talk about this here. You can read it yourself. Just focus on this classical vascular hypertrophy. Now let's see this. So classical Ehlers-Danlos syndrome is because of mutation in which collagen?
Type 5 collagen.
Yes, type 5. You know this. All of the following collagen mutation is involved in EDS except
B.
Yes?
B type 2.
Yes. So I told you to remember that trick. So EDS has odd numbered collagen involved, not even number. So not 2, not 4. 1, 3, 5. So that is how you can remember. Type 5. And now, which of the following EDS with autosomal recessive inheritance? Which of the following is Ehlers-Danlos syndrome with? Yes, B. It is B. You forgot. So let me see this choices: classical, kyphoscoliotic, and then cardiac vascular, and hypermobile. So we will take you to again. So you can see. So vascular, cardiovalvular, so it is autosomal. It is also autosomal recessive. Okay. You can see autosomal. This is also cardiovalvular is also autosomal recessive. Only this is autosomal dominant, this is autosomal dominant, and this is also autosomal recessive. And hypermobile is also autosomal dominant. So you can see here, this is, we are going to talk about this in detail, so that is why we focus on this. So this is also autosomal recessive, but don't remember this. Remember this only, kyphoscoliotic. And this is because of enzyme what? Lysyl hydroxylase. Now, classical EDS, you already know, it is because of type 5 collagen. So, no need to explain it again. You can see type 5 collagen and 90% is classical. So it is defect in type 5A1 and type 5A2 collagen. Two types of genes are again here. So what is the main presentation? You will see main presentation will be, one is the skin presentation, other is joint. So generalized joint hypermobility is very characteristic of this disorder. You can see hyperextensibility of skin and ectropic scarring. Why? So I told you, if you see, remember this type 5 collagen is associated with the cell surface, and this cell surface, it helps cell surface to attach with the connective tissue. So what will happen is skin attached to the connective tissue. This is skin. Remember, this is skin attached to connective tissue through type 5 collagen. If type 5 collagen is not there, it is not attaching this cell to, what will happen? This skin will have more freedom of flexibility, and then skin will be very much flexible. And this is a man you can find on YouTube, Gary Turner. So you can find he's named as Rubber Man. So you can find him on YouTube. So type 5, this is Ehlers-Danlos, classical Ehlers-Danlos syndrome. This is classical. People live a fairly normal life, except problem will be there in that patient, but fairly normal life. People can live a fairly normal life. So this is two features. One is hyperextensive skin. Three features actually. Two related to skin. One is generalized joint hypermobility. So you can see hypermobility of joint. You can see this is hypermobility of joint, and this you can see a statue, thin statue, and then scarring, lack of scarring, hyperextensibility of skin. So three features: lack of scarring, good scarring, and then hyperextensibility and generalized joint hypermobility. Generalized joint GJH, generalized joint hypermobility. So this is the feature. So now let's talk about this vascular Ehlers-Danlos syndrome. So vascular, when you say vascular, type 3 collagen, because type 3 collagen is present in vessels, that is where type 3, and the mutation is type 3 called COL3A1. So there will be aneurysm, artery, and there is collagen. If collagen knows, it will cause aneurysm of the artery, perianeurysm of the artery, and rupture at the young age, because this collagen is not there, so the pathology will happen in young age only. Organ rupture can happen. So spontaneous sigmoid colon perforation, this can happen, and then uterus rupture can happen. So the organ rupture and perianeurysm. So rupture type of vessel aneurysm and hollow organ or rupture. These ruptures are very peculiar to this vascular EDS. And it's carotid cavernous sinus fistula. You know this, in middle cranial fossa you have carotid artery, and this carotid artery has by the side of carotid artery there is cavernous sinus. So what will happen, because of its weakness, there will be fistula formation between carotid and cavernous sinus. So these are the very peculiar feature of vascular EDS. And why it is called EDS? Because there is associated joint mobility, hypermobility, and joint dislocation. So that is why it becomes EDS. Now you can see the rupture here. Aneurysm, you can see rupture, you can see, so sinus, you can see. So these are the features of EDS, vascular EDS. And this third EDS is lysyl hydroxylase deficiency. So lysyl hydroxylase deficiency is called kyphoscoliotic. You know this lysine hydroxylase is required for maturation of all type of collagen. Type 1 collagen, type 2 collagen, type 3 collagen, all collagen. And you know this type 2 collagen is present in vertebral column nucleus pulposus. This is vertebrae, okay, this is vertebrae, and then this is spine, and you can see this is the spinal canal, and this is here nucleus pulposus, this cartilage is present. So this will also be type 2 collagen will also be defective. That causes this twofold like this. And then type 5 collagen will also be affected. Type 4, type 5, all collagen will be affected because of this, and maturation will be affected because of when type 5 collagen will has problems. So you know there will be generalized joint hypermobility and dislocation of joint, and there even hyperextensibility of the skin, you can see. So this is a very peculiar feature that is associated with Ehlers-Danlos syndrome, and and this is a very peculiar feature. Kyphoscoliosis is associated with this lysyl hydroxylase deficiency. So remember, whenever I tell you kyphoscoliotic, it is autosomal recessive, and it is autosomal recessive, and it is kyphoscoliotic Ehlers-Danlos syndrome. So remember, muscle hypotonia, congenital early onset kyphoscoliotic. So these are the features of this kyphoscoliotic EDS.